My name's Alex George. I'm one of the medical students studying here at Peninsula. Your doctor's asked me to examine your knees today. Okay, Morgan, if you could stand for me in the middle. Inspect for scars, swellings, asymmetry, valgus severus deformity. Okay, you comfortable there, Morgan?
Yep.
I'm just going to assess temperature first. Begin your palpation around the patella. In Morgan here we can see some patellar subluxation. Also palpate around the joint lines. And palpate the collateral ligaments. Partially flex the knee and palpate the joint line for meniscal tenderness. Make sure you're looking at the patient while doing this. Follow the same process on the other knee. Use your palm to milk fluid from the anterior thigh towards the patella. Keep tight hold of the thigh just above the patella. With the other hand, press on the patella with the 2 fingers. If fluid is present, you will feel a distinct tap against the femur. This is called a patellar tap and is used to elicit large effusion. It is important to place your left hand on the knee and the right hand on the ankle so that when you move the joint, you can feel for crepitations. This is the anterior draw test. Your hands should be placed as seen. Pull firmly towards you from posterior to anterior. Laxity of the anterior cruciate ligament indicates a positive result, displayed by a forward movement of the tibia. This is the posterior draw test. Push away from yourself, from anterior to posterior. Laxity of the posterior cruciate ligament indicates a positive result. To test the collateral ligaments, we do the valgus or varus stress tests. These tests attempt to reveal instability to medial or lateral displacement within the knee. If the knee is seen to open up on the medial side, this is indicative of medial ligament and/or cruciate ligament damage. The varus test involves applying forces to the knee in the opposite direction, widening the joint on the lateral side. That completes my examination. I'll report my findings to the doctor and he'll see you shortly. Is that okay?
Yeah, that's fine.
Thank you very much. Nice to meet you.
And you?
On examination. On inspection, the patient has no walking aids or knee support. There is a normal distribution of wear and tear on the soles of his shoes. On close inspection, there are cuts and bruises on the anterior aspects of his knees bilaterally. On palpation, there was no increase in temperature or tenderness of either joint line. There was, however, bilateral patellar subluxation. There is a full range of active and passive movement with no crepitations. In terms of special tests, there was no laxicity or tenderness of the collateral, anterior or posterior cruciate ligaments. To complete my examination, I would examine the joint above and below, as well as perform a full neurovascular exam. Thank you for listening.